You're listening to Health Professional Radio. My name is Wayne Bucklar, and today my guest is Leanne Raven, CEO of SIDS and Kids, who's joining me from Melbourne in Australia. Leanne, welcome to Health Professional Radio.
Thank you, Wayne, and hello.
Now, I have to put aside my prior knowledge here because I have a really good idea of what it is you do, but some of our listeners may not. Tell us what it is that SIDS and Kids does.
Well, SIDS and Kids is a health promotion charity, and what we do is really threefold. We're about saving the lives of babies and children and supporting bereaved families. So we run health promotion programs or public health programs. We provide services nationally for families who've experienced the death of a baby or a child. And we also invest and fund research into the areas of interest.
Now, Leanne, SIDS is sudden infant death syndrome. I guess most of our listeners would know that. But you've extended this beyond the infant stage. Am I correct in that assumption?
Yes, in the support area, we actually support families who have experienced the death of a baby or child during pregnancy, birth, infancy and childhood. And it's sort of a niche market in a sense because it's those families who've experienced a sudden and unexpected death. Now, people can argue that, all death is unexpected when you're talking about children, but it means that we really support those families who've experienced in pregnancy, it may be stillbirth. In infancy, of course, it's sudden unexpected death in infancy or SIDS. And then in the older age group, it's, say if you're looking at 1 to 4, the most common sudden and unexpected deaths are accidental ones. So, they're poisonings, drownings, road trauma, those sorts of things. And then if you move to adolescence, it is youth suicide.
And you move through to the adolescence age groups?
Look, we don't put our resources too much in that area, but we don't turn families away. Anyone who has experienced the death of a child, if we are not the best support, then we find other supports for them in the community.
Yes, I see. And it is an area that is difficult to deal with, traumatic for everyone involved, and which absolutely needs the support of an organisation like yours, because otherwise it sits alone in our society.
Exactly. And, one of the things we don't want anyone to do is to think they are alone through this experience. And that can include anyone who's impacted by the death. So, it could be other family members, siblings, grandparents, or it could even extend further, to health professionals, first-line responders, so the ambulance workers, the police. If you ask any of those community groups, what would be a very stressful event for you, many of them would say that actually having to go to a family home where a baby has died is really high up there. So we really like to think that we're here to support anyone who might be impacted.
Now, Leanne, many of our listeners today will be clinicians of one kind or another. I guess about 95% of people who are listening will either be working in acute care or in aged care, doctors, nurses, allied health professionals, medical scientists, all those people who you get around a hospital or an aged care facility. Is there a message for them to take home today as a result of having this chat on air?
Absolutely. I mean, most of the community, and that includes all those groups that you mentioned, know Red Nose Day. And even if they don't know what, SIDS and Kids does, everyone knows about Red Nose Day. And, of course, Red Nose Day is our major fundraiser, and it's the happy side of what we do when we get out there in the community. But I think in terms of the clinicians, it's really important that they have a good understanding of our Sleep Safe My Baby health promotion program, so that, if they are able to provide information to their patients or clients in the community, then, that's really helpful. We have an online education program around that as well, which you can access on the website. And the other thing that we'd really like them to have top of mind is the bereavement services side. So, they may come across a family who are in hospital, for instance, and their child has died, a young child has died from a sudden illness. Could be a cardiac illness or anything like that. And to actually, mention to them that they may be able to speak with us at SIDS and Kids, and, we're very happy to help families through that difficult process.
And so is there any referral process needed, Leanne? People who are looking to access your support service, how do they do that?
Well, they can refer. We have a 1300 number, which is a national number, and that's 1300 308 307. Clinicians could give that number to families, or they could ring, with the family's permission, they could ring that number and refer into our services that way.
Lovely. Leanne, my favourite question in every interview. In every area of activity, in every business, in every charity sphere of work, there are misconceptions. What's the biggest misconception about your work that, drives you nuts and keeps you awake at night?
I think we probably touched on it already. And you mentioned it in the first sentence, Wayne, when you said that your work mainly involves SIDS and not the other things. I think one of the things that we find is a common misconception is around that area, that we only support families who've experienced SIDS. Now, we've had tremendous success in our public health program in reducing the incidence of SIDS occurring. It's reduced by 80% in this country over the last 30 years, and we continue to educate all health professionals and anyone working with children around that program so that never rises. But people don't understand the other side of what we do in supporting families who have a sudden and unexpected death at any time. And I think that's probably got a lot to do with our name, SIDS and Kids. The and Kids is meant to, embrace all the others. And that's something that we're actually working on at the moment in that, we're considering going forward with a different name in the future so that people understand who we are and what we do.
Leanne, let's hope that today we can help with that misconception just a little bit. And congratulations on that extraordinary figure for the reduction of SIDS. I didn't realise the success had been anywhere near that great in reducing the incidence of that. I'll just mention again that phone number, 1300 308 307. That was the Australia-wide number for people looking to get in touch with you, or the website at www.sidsandkids.org. Leanne, thank you for your time.
Thank you very much, Wayne, for the opportunity. This has been great.
Our pleasure, and it's been a pleasure talking to you. I always love when I talk to people who are passionate what they do. Your passion and commitment comes through in your voice. So thank you very much for that, and thank you for your time today.
Thank you.
If you've just missed my conversation with Leanne Raven, CEO of SIDS and Kids, the good news is we have a transcript on our website. We also have an audio archive on both YouTube and SoundCloud where you can listen to the interview for yourself. All of those resources are available at www.hpr.fm. You're listening to Health Professional Radio. My name is Wayne Bucklar.